There you go. My name is Matt Gross. I'm from SAS, and we've had the opportunity over the past year or so to be working with quite a few different companies in their efforts to do clinical trial data transparency to meet potentially some impending regulation. And what I wanted to bring today is really what we saw as some of the lessons learned from these early adopters around the resources, the barriers, and those types of things. So it's not so much about the data itself, but really about setting up these environments. I did want to go through the disclosure because we are working with multiple companies from all over the world, some of which have signed contracts to us with us and that we will be providing. So we are getting paid by some of the companies that do these. Also, we've worked in the past with and currently with Project DataSphere, another consortium that's more of a partnership than a commitment. And also, I have an investment with Pfizer. I do want to highlight for financial disclosure purposes, any company that I work for that's public, the stock does tend to go down. I work for a private company now, so everybody is safe. Moving forward, I just wanted to, the three areas about, the first one being resource considerations. The important thing here to know is it's not a single point that the companies that want to share data need to be concerned with, especially when you're looking at from a sponsor's perspective, a life sciences company's perspective who's trying to do this. There are resource commitments throughout the process. Some are one-time and some are ongoing. I'm going to just give a flavor. If we want to discuss these in more depth during the question and answer or afterwards, I'd be happy to. But I wanted to highlight, first of all, there's a lot of contract, and there's been lots of discussion, I won't go into that, about data sharing agreements, as well as if you're going to join in what we call a multi-sponsor environment, how you're going to interact with other companies that if a researcher does want to access your data in conjunction with somebody else's. There's a whole setup of an independent review panel and understanding how to get those resources and managing the process that they have to go through. As well as, and this was one of the lessons learned that I took away from one of the companies we talked about, when they were trying to figure out from a sponsor's perspective what data they were going to share, it took them a large amount of effort just to go through their inventory to see which ones they had, what their states were, and all that. So that in itself, they learned was a major resource commitment. Then once you got the implementation, somebody's actually agreed that the data is going to be available. Obviously, you've talked about data de-identification, the standardization, how you're going to manage that. That's a huge resource commitment and also one which people are looking at outsourcing as opposed to just doing themselves. And then also, besides the data itself, the case study reports, the redaction of that, and also identifying what supporting documentation you have. So there's resources that need to figure out what's already there, how to make it what we call self-sustaining or self-sufficient for the researchers so they can figure it out. And it also might involve, and we've done this with some companies, the creation of additional assets like videos or additional documents that you can put online, put with the data so that the researchers don't have to come to you. Because as was discussed earlier in the last one, you can call this an unfunded mandate. If you're going to argue, is there a huge ROI for sponsors that are putting their data out there, the answer is probably no, not up front at least. So they want to do this with as little commitment of their dedicated resources as possible. So part of that is setting up this self-sufficient environment for the researchers. Then once you have this, especially with the new clinical trial data transparency initiatives going on, there's somewhat of a constant uploading of information. When a new study has been approved for a research initiative and it's not there, somebody has to get that information and make it accessible on the site. They need to work with a company like ours or anybody else to make sure that the researchers have access to this environment. And then in some companies, they're very concerned with information being extracted without their consent from the environment. And what that means is if you're going to provide an environment for people to do analysis on your data and you want to put a gatekeeper in place to limit what information can come out, well, you better have somebody who's going to be able, you can do some of those with automated checks, but you might need resources on an ongoing basis to check what data is being requested to come out of the system. And then just from a day, how to keep the lights on, somebody has to make sure an environment is available for these researchers to have access to, that the tools are there. And the technical support, which can be outsourced, is easy enough, helping people with passwords and those types of things. But it's what was just mentioned before, the research analytic support, which is the concern that most companies are facing right now, which is they don't know what's going to be asked. It's really dependent on how many studies they put up there and what was covered. So they're most companies are looking at putting like a point person in place who will handle the first question, and then we'll figure out what internal resources are needed to follow up about, explaining what the data was or how that got there. So there's basically a wait and see attitude that many of the initial adopters are looking at, but knowing that this could be a big burden. And I'll talk about some of the alternative options that people are looking at that if we have time later on. I did want to highlight that when people are looking at setting up a data sharing environment, that they really need to look at setting up three pieces of the puzzle. The first is an environment that lets people know what information's there. Now, different environments may already have that in place, but as individual life science sponsors are looking at doing this, oftentimes they have to set this up or work with a partner to do this. And they need to not only handle what data they've agreed to give out, but handle the process of requesting data they have not agreed to give out and evaluating that. The next is the independent review panel to decide whether or not that needs to be, it should be approved, and if not, how to handle the notification. And the final part is the solution that allows the researcher to have access to the data in a secure way and whatever tools are available. And then the plus one that I've added is if you're going to do this with others, how to have an environment that allows the researcher to access information from multiple companies. And then finally, the one thing I wanted to highlight is we have been asked. I work with companies both large and small, and it's interesting. The larger companies have come to us and said they've been approached by nonprofits who also want to participate in a shared environment like this. Obviously, they don't have the deep pockets. So the challenge here is just because you're small doesn't mean you're not going to get a lot of requests or a lot of effort. So how do you handle that? Also, you still need the full solution. Whether you have one person or 100 researchers, you still need to provide the same level of access and support. And you want to be able to grow as it goes along. So some of the options just that have been discussed and others are considering is a hosted solution, so they can offload some of the work. A shared solution, which has really gotten a lot of traction, where instead of setting up your own, you're just participating in an environment where others have already set it up, and then allows for scalability, as well as setting up a community or outsourced approach for support, so that instead of always you being the one being accessed, can you almost set up an environment within this space where researchers can work with one another, or that you can do it in a moderated approach. So that's my quick overview. I'd be happy to answer any questions afterwards.